Great. All right. Well, I think we'll go ahead and get started. So my name is Martella Esposito. I use she, her pronouns. I am the partnerships and evaluation lead at NAVA Public Benefit Corporation. We're a public benefit corporation technology consultancy focused on making digital services simple, accessible, and effective. So I'm here and I'm joined by several of my colleagues, and we're excited to share our second and final demo day from our work with Montana WIC on a recertification portal project. This project was philanthropically funded through the Social Safety Net Product Studio, which was a collaboration between Schmidt Futures, the Gates Foundation, Ballmer Group, and the Schusterman Family Foundations. And so we're really excited to have been a part of this studio for the last, I want to say we're going on about 9 months now. And today we're really excited to be sharing actual demonstration of the work that we've done and some of our pilot findings. And all of that is to say as well, is that because this is a philanthropically funded project, all of the software is also open source as well. So with that, I'm going to pass it off to my colleagues to walk us through today's session, and I will go ahead and share my screen so that you can do that.
Thank you, Martell. And while that's getting set up, allow me to introduce myself. My name is Lauren Peterson. You can call me LP, and I'm the product lead for this, our WIC projects. And I'll be co-presenting with Daniela De Vera, our design lead, and Alana Flores, a product manager on the team. So today, on the next slide, you'll see what we'll go through today. We will introduce you to ourselves and our work in WIC. We'll talk about our WIC participant recertification portal project and demonstrate the participant experiences and staff experiences we built. We'll dig into our pilot phase as the topic of this webinar demo day is about how to run a pilot. And we'll talk through how we measured success and finish up with what's next in the Q&A. So to bring you to our introduction, I'll recap a little bit of how Martell introduced today. And many of you have attended some of these presentations before, but for context, NAVA is a public benefit corporation that builds government services that are simple, effective, and accessible to all. At a high level, we are a public benefit corporation helping to transform government services, programs, and agencies that serve vulnerable populations. And on the next slide, you'll see our work in WIC. Our WIC work has been and continues to be a multi-year initiative made up of many projects. Through these, we've been building a deeper understanding of the WIC technology landscape, working with the National WIC Association and the broader WIC community. We published landscapes assessments in 2020 and an updated version in 2023. We built an eligibility screener referral and API prototype in our last project, helping us learn towards our API standard vision by collecting the evidence for the value of API integrations. We've also, we've also been having the opportunity to advocate for both within states and with FNS for systems change that our approach and recommendations can achieve. And we did form the WIC Technology Resource Group with the National WIC Association, providing opportunities to learn more about human-centered design and modern software development practices. So now I'll move to talking about our specific project, the WIC Participant Recertification Portal. This was a philanthropically funded project of the Social Safety Net Product Studio, a collaboration among Schmidt Futures, Gates Foundation, Ballmer Group, and Schusterman Family Philanthropies. And the software, as Martell mentioned, we built is open source. And an integral part of this project has been to share our learnings in channels like this demo day. In this project, we were focusing on the recertification phase of the WIC participant journey, which you can see on the right side of this service blueprint snippet. 2023 data shows that 36% of eligible individuals participated in WIC in our partner state, Montana. Participation declines with each birthday, which typically marks 1 year of enrollment when someone would need to recertify that they're eligible for these benefits. Infants, so newborn to 1-year-olds, make up 22% of participants, while all 1, 2, 3, and 4-year-olds made up 57% of participants, which is lower than we would expect given how many infants are enrolled. Year over year, there's more drop-off at that recertification point as kids grow. Our goals center around retention and reducing burden, though we note that many of the things we learn in the context of recertification can also be applicable to initial certification and enrollment. And also we know we're coming into a context, a post-pandemic, I say post in quotes, reality where this process is both online and offline right now. So some WIC participants are having an easier time recertifying given they're able to do this without coming in person in some scenarios. So our project goals that we outlined are specific to our solution and what we're building. They include reducing the synchronous time spent in administrative barriers in recertification appointments, increasing retention in WIC, and sharing the approach and outcomes of our work, contributing to a strong foundation for our partner Montana and other state and local agencies to design and build portals like this. And tangibly, what this looks like in terms of what we did were the outputs that you see on the screen. We established a participant advisory council, which we spoke about in our previous demo day in February. We built a minimum viable product version of an open source participant recertification portal that includes static content about recertification and some other elements you'll see later in the demonstration. We piloted this recertification portal alongside the staff experience with a small set of users in Montana. We've published the research toolkit you see on the right side of this slide that we encourage you to check out to use to engage with your users, your participants, and understand what they need from a participant recertification portal. And we're in the process of publishing a technical toolkit that for WIC agencies to use to adapt and enhance the portal to meet your needs and work within your workflows. And we did this all over the past 8 to 9 months. Our project timeline and roadmap started with some research, establishing that participant advisory council, understanding participant user needs, and also interviewing Montana staff for their needs. Spent some time research and from that research, prototyping experiences, getting some feedback, usability testing those prototypes. And the bulk of the time was spent building and testing our MVP participant recertification portal and staff portal. We finished up the project with prep for a pilot, conducting that pilot and analyzing the results of that pilot and have come, our project has come to a conclusion and we're happy to share the results with you today. And just another quick plug, our first demo day back in February focused on how we engaged with participants, and you can watch this presentation on the NAVA website. I'll quickly post that in the chat. And now I will pass it to Daniela to talk with you about our participant experience.
Thanks, LP. As LP mentioned, my name is Daniela De Vera. I use she, her pronouns, and I am the design lead for this project. So talking about the participant experience, on the next slide, we're going to look at what the shape of the scope of our MVP was. So on the left in the light blue, we have the participant-facing experience. When we were planning this out, we imagined this would consist of some introductory static content about what this was, what the expectations were, et cetera. We imagined that users would enter some demographic information that we could use to identify who they were, as well as some of the data needed for recertification. We also imagined that in some cases they would need to upload documents, which we will talk through in a little bit. And then after they did all of what's there, they would view next steps content so that they would know what to expect next, if they had an action to take, or if they should be waiting for their appointment, whatever that might be. On the right is the staff-facing experience. What you see here in yellow is also matching what's in the blue box in yellow. So that data that participants would submit would get transferred over to staff. And then for the MVP under the hood, what's making this all happen is the technical infrastructure. Of course, our work was informed by the privacy and security standards that Montana has. And then the metrics and analytics that we implemented to help us understand, who are our users, how many folks were visiting the sites, and what pages they were dropping off, those types of things that informed some of the measurement that we did that we'll talk through later. So what this actually looks like is a total of 8 to 9 web pages, depending on a user situation, to collect demographics and documents. And what we built is mobile friendly, so it works on the phone. I actually think it looks best on the phone, but I'm biased. It also works on a tablet and it works on the desktop as well. We have error validation in place to reduce any typos or mistyping. And then we also tested all the content and design of the application with WIC participants through our participant advisory council. We iterated on what we ended up piloting based on the feedback that we got from those sessions. So much appreciation to those folks. They helped us get this into the shape that it is today. All right, and then we're going to go through a little quick demo here. So this is our demonstration site, which anybody can look at now. You can use it to submit data. It won't get saved. Rather, it just is here to show you how it works. We have this information, the static information at the top, explaining what this is and what the process is. And then just noting that this doesn't guarantee your enrollment in WIC. This is just to help for your recertification appointment. You can enter your name, who you are, and then you will answer a few questions about who in your household is recertifying. This person's just reading through what does that mean, and then a little bit about how to make sure that you're accounting for the right people in this. Then we fill out information about who's recertifying. This might be different than who's filling out the form for folks who are filling out information for their children who are WIC participants. Maybe they're not active participants themselves. Some of the demographic information we're collecting is the date of birth of the WIC participants. That helps staff identify who those folks might be inside the MIS. And then we're asking if the participants are enrolled in any of these programs, so like SNAP, FDPIR, Medicaid. This is helping us understand what documents we might need to ask somebody in case they do not have adjunctive eligibility. This person's filling out the form for their second beneficiary. All right, so this person is enrolled in Medicaid, SNAP, or TANF. You can also on this page add or delete more participants in case filling out this information you've realized you've forgotten someone or you actually didn't need to include them. Then we ask about household changes. So if you've moved or if you've had a name change, and then that would inform if somebody needs to upload documents or not. So what we have here is a little bit of guidance. Oh, sorry, Martel. A little bit of guidance about what documents somebody might need to include based on what they wrote earlier in the form. So this person said they moved, so they would need to show proof of address. We've also got some tips for uploading images or PDFs. This is something that came up when we were doing, when we were talking with the PAC, like what documents might you have on hand? What formats? This also is a little bit helpful for if you are trying to do it on the phone. Then you can upload documents. We have this last page, which is additional information. So phone number in case we need to contact them, but it also helps for locating their record in the MIS. And then we had this open text field, just is there anything else you'd like to share with WIC staff? We mainly included that to kind of see what people would say, but we also imagined some scenarios based on what we had heard from PAC members about what they might want to share with a WIC local agency staff member ahead of a recertification appointment. So something like, here's what's different about my case this time, or I was having a specific issue with like a child's eating habits. So those are the types of things that came up. That was fast, but it's in the slides for you to look at. And again, we have a demonstration site, which we'll share at the end of this presentation, the link to, so you can play with it on your own. So some scenarios that the participant portal does not support, it focuses on recertification. So right now, all of the content is written for clients who are currently receiving WIC benefits. There's some jargon in there. There's some kind of like, you know what this means already. So this is not right now designed to support initial certification. It's also not designed to support situations where someone might be required to complete a self-declaration form, and that is called out on the portal on one of those first slides. So first screens. So if you don't have any income, or if you do not have a permanent address, or if you do not have identification documents, then you would not be able to use the participant portal. You would have to go in and to an office. This also not supporting right now foster parents who just need to provide proof of placement. And we are not supporting languages other than English at this time for the pilot. All right, so now the staff experience, what does it look like from this side? As I mentioned before, the staff see the information that we just walked through in the demo. They see that demographic information, recertification data, and any of the documents that were uploaded. So how do they interact with this data? We built a staff portal in a low-code tool called Loadify. And it demonstrates the information that somebody submits in a simple table view. And you can also download this information as a CSV at the top. So a staff member would see the information for only their agency's relevant participants who submitted their data. And you see the submission date, as well as all that demographic information we went through. So the name, the number, and then the agency that's coming actually from the URL that somebody received when they were prompted to fill out this portal. You also see the information for those participant cards that somebody would fill out in terms of who the WIC beneficiary is, if they reported any changes, as well as the documents that they uploaded as links. And then if anyone put anything in that empty or that free text field at the end, is there anything you'd like to let WIC staff know about? That's also included in this table view. All right, and then the next slide just shows this. The videos are a little wonky. Thanks, Martel, for dealing with those. This next slide just shows these components. The links to the documents are here. I didn't click on those in the demo, but those would just open as a new tab, and then somebody could download them from there. And then the next slide shows how the staff portal would be used before a recertification appointment. From the staff perspective, so what we worked with staff to develop is that in MSpirit or SIS or in whatever way they were tracking appointments, front desk admins would review the upcoming appointment schedule and identify which of those upcoming appointments were recertification appointments. Then somebody on the staff, we talked about citing those responsibilities, who might do that. They would review the portal information for those incoming recertification recertifying clients. They would review that information inside the staff portal, inside Loadify, that low-code tool we built. Again, looking at the submitted demographic information as well as any of those uploaded documents. If that person had written in their submitted information that they were receiving Medicaid, then staff could use SIS, which is one of their systems to check or verify on their Medicaid status. Inside MSpirit, the MIS that Montana uses, staff would then use the alerts feature, and that basically allows them to leave a note for anyone else who would be looking at that record to communicate, hey, the Medicaid check is done based on what I saw in the staff portal and SIS. And here's the documents that I saw, and then note if there were any missing documents or anything else that somebody would need to bring into their recertification appointment. So when staff was looking at it during appointment, they would have that information. If applicable, then somebody could view and print out the documents from the staff portal, and MSpirit right now requires paper documents to be scanned into a record. So at that point, you would do that. We did also design flows for other scenarios. So like how the portal could be used during an appointment for participants who had documents on hand that they may have brought in an appointment, or if they had been missing one and they needed to go back. We outlined all of those flows, and we shared those with staff during the training that we did, as well as the written protocols that we developed to support staff while the pilot was happening. All right, that's a very quick overview of the demos, but now I'm going to pass it to LP to talk about how we piloted what it is that we built.
Thank you, Daniela. So to kick off this phase, this section about our pilot phase, I'll first define pilot testing on the next slide as allowing a small group of users to test the product and its functionality in production before it's introduced more widely. So this was a production site that we turned on for the duration of the pilot. So real WIC participants and real WIC staff could interact with the products. At NAVA, we use pilot testing on many of our projects because of its many benefits, including learning how to iterate our functionality to better serve user needs and support program outcomes, and mitigate risks before launches to broader audiences, and validate that we are building the right thing. Our objectives for this pilot were to learn about the acceptability, appropriateness, and problem solution fit for a WIC recertification portal and how to improve it. We also had the goal to understand whether access to and use of a portal for recertification improves participant retention in the program and gain insights about why. Our pilot timeframe was Monday, May 1st through Friday, May 26th, right before Memorial Day. And our pilot participants came from 4 agencies across Montana, that in yellow to the right. Our pilot participants were both WIC participants who have recertification appointments during the pilot timeframe, as well as WIC staff who interact with those WIC participants and will use the staff portal. We analyzed 3 pre-implementation and during the pilot data sets, including MIS data about retention, product analytics data to understand product use, and user feedback data via participant and staff surveys that we'll talk through in our pilot analysis section. But here on the next slide, you can see what the pilot process looked like. The pink boxes are touch points that participants had. The gray one is what staff did in the background. So we worked with Montana technical staff to send out text message appointment reminders that included a link to the portal ahead of someone's scheduled appointment. Then participants could use the portal to submit information and documents ahead of their appointment. And at this point, there was an optional survey for them to fill out with any feedback on the site. On the staff side, they used their portal to view that submitted information and save it or scan documents into their management information system, MSpirit. Finally, participants attended their recertification appointment, and after the appointment, they were sent an optional survey about their experience, again, via text message. And here's a view on the next slide of how we notified participants they could access the portal. We had reminders 7 days before appointments and 1 day before appointments. And we crafted a text message with a link to the portal, but ran into the product teletasks character limit with our URLs and decided to accept a link that was automatically shortened by teletask, so had the word teletask written in the URL. We also sent the post-appointment survey after their appointments. And after staff training and final setup, we got to piloting. So how did the pilot go? First, I want to highlight that we used a logic model evaluation framework to guide our evaluation and measurement planning. Notably, our thinking of how our work building the participant recertification portal relates to the outcomes we want to achieve and how we might measure the outcomes in a pilot. In order to make sure we're on track to achieve the long-term desired program outcome of retention, we measured outputs, implementation outcomes like portal adoption acceptability, and service outcomes like administrative burden to know where the points of success and failure were for future iterations of the product. And here is an overview of the key outcomes presented in the prior slides and how they fit into the context of our goals and what specific metrics we defined to measure against them. This also shows those key data sources we relied on for measurement, which will break down through this section of the presentation: portal usage, participant and staff surveys, and MIS data. These outcomes and these metrics were not only measured during the pilot, but also during the development process leading up to the pilot through user research and usability testing. For example, we usability tested prototypes early in the development to validate the direction of the participant portal, including its content and design, getting some indication about acceptability, appropriateness, and problem solution fit. I will pass it to Alana to talk about the first set of data we analyzed from the pilot, portal usage.
Awesome. Thank you, LP. As LP mentioned earlier, I'm Alana. I use she, her pronouns. I was a product manager on this project, and I'm going to dive into our metrics further by first talking about portal usage. For the usage of the portal, I like to think about it as a funnel. As you can see here, there were 304 people that had recertification appointments scheduled during our 3-week pilot period. From there, 194 of those people received at least one-day reminder text containing a link to our portal. Like LP mentioned earlier, we also sent out 7-day reminders as well, but we're focusing on one-day reminders here just to look at the number of unique participants we sent text messages to. And then from there, 80 unique participants actually got onto the portal. And finally, from that 80, 29 participants made submissions to the portal. Now, we experienced drop-off at each of these points in the process, and there's something that we learned at each of these stages. So I'm going to walk through each of these steps in more detail, as well as our findings and recommendations. To start off here, high level, 64% of participants who had recertification appointments actually received the link. And so that's 194 people that received text out of the 304 people that had appointments scheduled. And there are some reasons why all the participants with appointments did not receive text. The first one is that if participants canceled their appointment more than one day before, then they didn't receive that one-day reminder, but they still had an appointment scheduled. So they might have received a 7-day reminder. And the second idea here is that many participants have opted out of text messages, or potentially they don't have the correct phone number. So either participants in those two groups would not be able to receive text. So our recommendation from this finding of how many people actually didn't even receive the link in the first place that had appointments scheduled are to research how participants respond to text messages and what the ideal channels for engagement are, and potentially add some alternative ways to reach participants with the link to our portal. From there, like I said, we had 80 participants who actually got onto the platform. And in thinking about how to boost this rates of participants who clicked on our link, our hypothesis is that maybe we didn't set enough context about the product and pilot for participants. So our recommendation here is that there needs to be trust built so that participants actually feel comfortable clicking on the link. And this could potentially be accomplished by doing some outreach ahead of the next pilot. For example, staff could make participants aware that they'll be receiving this text in advance of their appointment. Another idea is around the link we presented earlier that we used due to the character limits. And that link was not very readable or obvious. So another recommendation would be to rework our messages that we were sending out to use a more readable link, such as the one that I've put here in parentheses that actually includes WIC as well as a participant's agency name for more clarity. Now, finally, we had 29 total submissions on the portal. And our idea around drop off here is that participants were probably coming to check out the site, but maybe they didn't have enough context to actually go through the flow. So what we saw is that drop off occurred in the first 3 pages. Another idea here is that participants viewed the site with their 7-day reminder, and then they didn't actually return after receiving their 1-day reminder. So our recommendations here for a future pilot are similar to the previous step, which is that we would want to increase outreach ahead of the pilot to make participants more aware that this is an option that they will have, and to look out for texts or potentially other mediums where this link is available to them. Another idea here is that if we had a longer pilot timeframe, we would have dug more into repeat users to see who was coming back to the portal after which reminders, 7-day or 1-day, or potentially others, to understand what that user's flow looked like in order to actually get more people to submit who were coming onto the portal. Okay, I'm going to now shift to our next data source we looked at, which is surveys. There are 2 groups that we surveyed, which are participants and staff. And I'll start by overviewing the results from our participant research. We did user research in December and January with members of the Participant Advisory Council, and here listed out are some of the highlights of that research. The first is that due to adjunctive eligibility and federal waivers, some participants reported not having to provide any documents when recertifying, and that these recertification appointments often only took 10 to 15 minutes. And this is the reason that participants said that recertifying over the phone was relatively fast and easy. The second point here is that most participants we interviewed recertified over the phone, even with the clinics now open, and they see this option as more convenient because recertifying in person often adds more logistical hurdles, of course, which are not always feasible to overcome. The final point here is that participants gave us multiple examples about how they feel supported by clinic staff and how much they appreciate the personalized care staff showed towards their families. Now, here are our survey results, which echo the positive responses we got from the participant research that we did earlier in the project that I just presented. Something to note here is that the baseline recertification process was already relatively easy for participants for 2 reasons, similar to what I just said, which is the first one is that COVID era waivers for remote services have continued. So participant recertification appointments can be remote and therefore less burdensome than in person. And number 2 is that Montana's policies are designed to make the recertification process easier for participants, because participants only have to upload new information, whereas other states require participants to provide documentation at each recertification appointment. Now, in our participant survey, which we show the results of here, participants' responses were overwhelmingly positive when we asked about the recent process of renewing benefits and how prepared they felt for their appointments. And there was no difference in these responses on average when we compared their responses pre-pilot and during the pilot. Another note here is that for the respondents who said they actually used the portal, all of them said that it at least helped them some way in preparing for their appointments. So the takeaway from this is that the portal seems to fit pretty neatly into the current process of participants who responded to the survey. I'll now pass it back to LP to walk through our staff survey results.
Thank you. Our staff survey results were more robust than the participant survey because it covers a greater percentage of overall staff pilot participants. The big takeaways from their answers to the questions you see on the screen are that staff were slightly less than neutral in their overall satisfaction with their staff portal, which we'll dive more into on the next slide. Staff document collection ease, though higher during the pilot, did not change very much because this process was only for, I think, a small subset of users. And for context, the current documentation collection method is secure email or text messaging images and documents to Montana staff, who then print and scan into their MIS. The biggest thing to note from this in the survey taken after the pilot is that there was a lot of variation in staff responses. A lot of staff who had some good experiences with the portal and a few with some poor experiences. We believe the results would be different if we had even more time for staff adoption and time to iterate the staff portal at least once during the pilot to address feedback that was left in the open-ended portion of the survey. And here's a view of that staff feedback from the survey that would inform future iterations, our recommendations for future iterations. Pulling out some key recommendations, if we could iterate this product, we would want to refine the content in the portal to increase submissions with accurate and complete information. We'd also want to research how to make the PRP work not only for recertifications, but also for initial certifications, because the processes and mental models are similar. And in addition to the questions shown on the previous slides, we adapted the administrative burden scale and included a question in the staff survey. And you'll see that on the next slide. Administrative burdens are extra time or cognitive or emotional resources required to complete tasks. The Better Government Lab at Georgetown has been working on a new way to easily measure administrative burdens called the Administrative Burden Scale. This work is led by Don Moynihan and Pam Hurd of the Administrative Burdens book fame, and their work is also part of the Product Studio cohort that funds this project. As such, we've had the opportunity to be an early adopter of this scale and give feedback for further iterations. The results of this question in the staff survey were that frustration and stress stayed the same, and staff felt slightly less in control during the pilot. This reiterates what we've learned over the past couple projects in WIC, that without interoperability with MIS source systems, staff often experience increased burdens when attempting to improve the experience for participants. We hypothesized that adding a new tool into a workflow was burdensome and requires more adoption time than was allotted in our project. And there's a common thread on the next slide among the participant and staff experiences that aligns with our vision for modernization in the WIC program. That lack of integration with MIS source systems continues to present barriers for participants and staff. On the participant side, an integration with Montana's MIS would simplify the participants' experience by reducing the amount of information that they needed to provide. Ideally, we could show the user who is recertifying so they didn't have to distinguish that themselves. Say, for example, if their appointments that day included both an initial and a recertification. And as I mentioned, for the staff side, results lead us to believe the most useful feature for staff administering recertification appointments in their staff portal would be that direct integration with MSpirit to prevent manual data entry into the MIS and improve that printing and scanning process. This aligns with our WIC program recommendation to implement an API standard policy that opens up MIS interoperability and the WIC ecosystem for these types of innovations without burdening users too much. I'll pass it back to Ilana to talk about retention.
Great, thanks, LP. So retention is the final key outcome that we looked at in context of our pilot, which I'll walk through. There are a few things we did in the design of this pilot to give us the potential opportunity to look at the causal impact of our portal work on retention, and this was one of our stretch goals. So the first thing we did was set up a quasi-experimental design, which means we looked at data from both pilot participants who had access to the portal during their recertification process, and then comparison participants who did not have access to the portal during their recertification process. The second thing we did was match these two groups of pilot and comparison participants according to characteristics in order to minimize variance across these groups over time. And we did that using control data that we collected about individual participants and their associated clinics. Now, finally, we decided to perform a difference in difference analysis, meaning we effectively looked at the differences in retention outcomes between these pilot and comparison agencies. Now, even with all these intentional pilot design choices, our ability to actually attribute a causal impact of our work on program retention outcomes depended on, one, how much retention actually changed during our pilot period, and two, the sample size of participants who actually had access to our product. Now, this kind of evaluation where we're trying to show causation is something that's definitely newer for civic tech, but we've been thinking a lot about it, and we're starting to see it a lot more across the field. Now, it's not easy, which is why we haven't seen a lot of it in the past, but with this kind of intentional evaluation plan, it can be within reach. So we were very excited to set up this framework for what that could look like in context of this project. Now, I'm going to share the findings from this setup based on the actual data we got from the pilot. And the findings were that our pilot had no statistically significant effect on retention. So more specifically, we looked at two main outcomes. There was no measurable effect on whether or not an individual recertified during our pilot period, which is our retention metric. And there was no measurable effect on the number of participants who were unable to recertify because they had missing documentation. That's another metric that we looked at because we hypothesized that the portal might more directly impact that. And the largest note here was that our sample size was just too small. The idea here is that even if the portal had an effect on retention or missing documentation, we actually wouldn't be able to detect it given the small number of participants that ended up using the product. So our largest recommendation here is that we need a longer pilot to have more robust measurement of these longer term outcomes. So this longer pilot would allow us to do a couple of things. It would allow us to increase our sample size so we actually have enough people to measure our impact on. And it would also allow us to count for any lags in the effects that we were measuring, because it takes time for staff to get comfortable with the product and also for participants to become more familiar with the idea of it. And hopefully with a longer pilot, you'd be able to have more adoption. I will pass it back to LP now to talk about what's next.
All right. Yeah. So as you can see, we learned a lot from our pilot, and I'm here to talk to you about what's next. So we've published our research toolkit about how to build a participant advisory council, and we will soon publish our technical toolkit about how you can adapt the participant portal to your agency's needs. And from the learnings that Alana walked through, we would really love to iterate this participant recertification portal and staff experience. We'd love to incorporate the staff and participant recommendations that we didn't have time or resources to do during our project time period. And we'd love to experiment how this portal fits into other states. So please do let us know if you're interested in helping us iterate this or piloting in your agency, because it did seem to fit into participants' workflows. We just need a little bit more data to prove that out. So thank you all so much for attending today and for hearing about our experience piloting this participant recertification portal. I'd like to pass it to Martel to facilitate our Q&A portion.
All right, thank you so much, LP, Alana, and Daniela. Great presentation. Yeah, let's take a look at some of the questions, which I actually haven't had a chance to look at because I've been doing the screen share. So if you all already see them,
sure,
start answering, you can go ahead and do that.
Yeah, I'm happy to. So one of the questions submitted was, does Montana WIC have a texting system that is integrated with their scheduling system? And I answered that Montana has some data transfer processes in place between their MIS and Teletask. I don't think it is a direct integration in that they do have to upload MIS data into Teletask about upcoming appointments. They've automated aspects of that process. However, it is not, say, a direct integration. And another question is this portal only usable for prior to the start of a certification, or could it be used to upload documents after a certification that may have been missing at the time of the certification? And I'll pass it to Daniela to voice her answer to that one.
Yeah, thanks. So what we shared when we were going through the flows was how somebody might access the portal ahead of a recertification appointment, but we also worked with staff to outline how they would share that during an appointment, say if they needed to get a document from someone that they identified during the appointment, or afterwards if someone was like, I need to find this, they can access it afterwards as well.
Awesome, thank you. I'm seeing a couple other questions coming in. So one from Kelly, do you already have an agreement with Teletask? And Nava does not, but Montana, yes, already had been working with Teletask. And when we were designing the pilot processes with Montana and how we would get this link to participants, Montana helped us decide, let's use Teletask, let's reach out to participants in that way. And an earlier question in the webinar from Doris asking, Teletask allows for emails. Have you considered this as an alternate tool to reach participants? And great question. I think, we did consider it briefly. However, we found that email was not always collected from participants. So we decided to stick with texting, which had more, we had more of that data for participants. I'll move on to the next question. Where would all the data be sent by participants live? Please tell us about your portal security. Thank you. We met with Montana's security group at the top of the project and learned about their security and compliance practices. And their policies wanted all FedRAMP and SOC2 compliant tools, which we did use. And in our portal, we collected data into our database, but since the pilot has completed, we've purged all of that data from our system. So as we would adapt this portal with other states, we would want to understand security and privacy requirements. We would share the security and privacy best practices we adopted, and you are welcome to read more about this in the soon to be published technical toolkit. Okay.
Lots of great questions.
Yeah. I'd love to move to what happens to the data once it is viewed on the staff portal. This speaks to one of our recommended feature requests to consider for future iteration. We did not have a way for staff to mark that they've reviewed that, say, row in the staff portal, though we would love to build that. So other staff can know, yep, this has been reviewed, and that data from the staff portal that came from the participant portal was transferred into Montana's MIS via, say, alerts in the alerts feature in their MIS, or that printing and scanning process for documents.
And is it fair to say then, LP, like depending on the state system, an integration could happen with the MIS?
Yes, there are some MIS out there that are that might be more easy to integrate with than the Spirit user group system. So go for it.
I'll add, LP, that it is also possible for that information to be integrated into other tools that staff might be using to help with their workflows. It doesn't need to be the low-code tool we used, but I know other states are using like Microsoft Suite tools to help manage some of their workflows. So there's potential it could be integrated into something that staff are already using day to day.
Mhm. I'll next go to Jen's question. Can the portal be used to sign up for WIC? Does it have appointment scheduling options? At this time, this portal was scoped only for the recertification use case. Our previous project with Montana WIC, however, was targeted more towards that initial appointment with WIC, initial contact with WIC, where a potentially eligible WIC participant could figure out a little bit if they were eligible before then setting up that initial certification, where WIC would confirm their eligibility. And we see a future where participant portals like this, especially user-driven ones via our user research practice of the Participant Advisory Council and other user-focused testing we did throughout this project, to expand portal functionality to other use cases. I know that the former Montana WIC director really wanted some appointment scheduling innovation. And so that's something that we see as a feature of a participant-facing portal, though no, not at this time, we did not build that in. The project wasn't scoped to include that.
And I just want to highlight this particular project was for a very specifically defined time period. So through the process, we were defining with Montana, which were what were the priority features. But that is definitely part of Montana's longer term vision, is to have appointment scheduling. And it's something that can absolutely be added to this existing foundation.
Our next question is, how have stakeholders in Montana reacted to the results of the pilot? I'm curious for Martel or Daniela to answer that one.
Sure, yeah. So we're currently, I know Montana is really interested in scaling this work. So they're having conversations about how they can take this work to the next level and scale it across the state and iterate on it. So generally positive, although if there are folks from Montana on the actual webinar right now who'd like to type anything into the chat, you are very, very welcome to. And I think I can take the next question as well, which is, how did you choose the pilot sites? So the implementation sites were chosen by the state agency, and I think that was through identifying agencies that were interested in doing the implementation. And then we did our best to match comparison sites and comparison participants from the rest of the state as part of the pilot analysis.
Okay, moving to the next question. Could you see this included in a phone app? For instance, an app where participants can view their benefits, a food list, have a clinic and vendor search, and then include a portal for them to upload documents. Daniela, do you want to share your perspective on this one? I can start.
I think that there's a ton of opportunity for comprehensive digital touch points to be aligned in a way that makes sense for users. Like, we hear a lot about, one-stop shop, or having everything on hand. And I think that that's a great vision for state agencies to work towards, as long as it is being informed by what users are actually telling you that they want and they need. I think one of the challenges, of course, is how you get all of the data into one place, in a place where users can then access it. Sometimes this data is coming from different sources. So having to integrate EBT data as well as some of the potential benefits data, that can be a challenge, especially with some of these older MISs. So that's, I think it's a really great vision, and I think it's something that we want to work towards. I think that I just get a little, I'm like, oh, okay, I can start to see where all of the barriers might be. And I think a lot of it is in the data, from the data side. But I think that this is what participants want. Everything that we've heard from them is they want to be able to access information about their benefits, like whenever it occurs to them, not just during business hours. So phone-based applications, or other online resources are a really great way to support that participant need.
Yeah, the only thing I'll add is, as Daniela mentioned earlier, this product already is usable on the phone, though not an app you download from the App Store, but a web application that is responsive to the mobile screen size and things like that. So I think that these types of products don't necessarily have to be apps from the App Store to be usable on the phone and also comprehensive, like viewing benefits and things like that. It's all about iteratively building functionality based on users' needs.
Great. And let's go to the next question. Do you have privacy rules / compliance addressed in your toolkit background information / planning information?
And yeah, we do have a section on security and privacy in there. Let's see, we talk about the requirements we learned from Montana, and we also talk a little bit about some best practices like data encryption at rest and in transit, storing hashed and salted user passwords, not the originals, salting browser sessions using an encrypted variable, limiting production access and resources, and logging access to participant data and production resources, so we can keep track of those things. So that gets a little bit into the weeds, but we will include these types of topics in the to be published toolkit.
Great. And I'm going to combine all of Doris's questions and see what insights Alana has, but it's related to the 1 day versus the 7 day reminders. And then did we see them folks viewing like immediately after receiving the text message, or were they coming back to it? So Alana, take it away.
Yeah, I'm happy to take that. Okay, so the 304 people were the number of people who had scheduled appointments. The number of people who received 1 day reminders was 194 people. And only about 2/3 of the participants in our pilot received the 7 day reminder because our portal was available for 3 weeks. So only the people in the 2nd and 3rd week of the pilot received that 7 day reminder on the first day that our pilot was available. So I don't have the exact number off the top of my head of 7 day reminders, but it's probably about 2/3 of 194. So maybe about like 130 people received that 7 day reminder. And then to your question about which reminders people were coming to the portal from, that's actually something that's in our future recommendations section, because we weren't able to track that through Teletask because we didn't send out separate links to people. That one was a distinct 7 day reminder that they were coming into the portal from, and one was a distinct 1 day reminder. We had that list completely combined, so we actually weren't able to track when users were coming from which reminder, and then if they were coming back at different days. So that's an open question that we're also curious about, but a really good one.
Yeah, great. I think that was, oh, we have one late breaking question that is related. Do we have any insights about the time of day that produced better user responses? And I think that answer is no, based on what you said, right, Alana? We weren't able to know when folks were responding. Yeah. But good question for something to study in the future. And that brings us right to our time. So thank you all for joining us. The Participant Advisory Council User Research Toolkit is currently available on the NAVA website. and the technical toolkit will be available soon. And please don't hesitate to get in touch if you want to talk more about anything that we've done in this project. Yeah, if you're interested in potentially doing future iterations. Thank you all. And now I'm going to stop the recording. I'm having difficulties today. I don't see where to stop the recording. I might just go ahead and end the meeting. Thank you, everyone. Bye.